This is Church of Uganda Family TV. Enriching lives. Regulated by the Uganda Communications Commission. Issues at hand.
Well, good morning to you once again. This is Issues at Hand, and of course, today we are looking at the situation of HIV/AIDS in Uganda, but also we are going to talk about the National HIV and AIDS Symposium 2025, which is happening this week in Mbarara. Why, when, who qualifies to be part of that event? But most importantly, we want to know about the status of HIV and AIDS in Uganda. And of course, with us is Dr. Daniel Byamukama, who is the head of HIV Prevention at the Uganda AIDS Commission. Doctor, it's a pleasure having you this morning with us.
Thank you.
Yeah. Good morning, and kind greet our viewers. Then we discuss in details.
Good morning. Good morning, our listeners.
So we want to look at the situation of HIV/AIDS, and can you tell us briefly about HIV/AIDS situation in Uganda currently?
Yes, thank you. Like we do annually, we update our statistics, we appraise our performance in the year, because every year we set targets.
Okay.
So we see that this year, the total number of people living with HIV continues to increase. There are two reasons for that. Number one is that the people who have HIV are on treatment, so they live longer. The problem is there are additions. Every year there is an additional number of people contracting HIV. So if those who already have HIV are put on treatment and they are living a normal long life, then when we add on those new who contract HIV, the number can only go up. But as a country, we are working towards what we call epidemic control, where one time I'll come here and I report to you that the number of people living with HIV in the country now is less than it was last year.
Okay.
We attained that status when the number of new HIV infections has been reduced so low that the number of people living with HIV who die from normal causes, drowning, accidents, old age, is more than the number of people contracting HIV every year. So at that stage, we say we have attained epidemic control. The size, the population of people living with HIV starts reducing, and we're working towards that. So last year, 37,000 contracted HIV, which is not a small number.
Yeah. We
only managed to reduce by only 1,000 from the previous year. So the previous year, 38,000 people contracted HIV. This year, 37,000 contracted HIV, which means the energy and momentum we thought we would put in this year was not that very much, we increased a little, but not significantly.
Okay.
But the good news is that we have newer tools. If we employ them, maybe if I come here again next year, I may report really tangible achievement in a reduction in the number of new HIV infections.
Okay.
We notice that our brothers and sisters who have HIV are still dying of AIDS-related illness. Last year, 20,000 died of AIDS-related illness. And now, this is almost the same number in the previous year. So in reducing AIDS-related death, it looks like we did not achieve so much. The issues which are stopping our people from coming from the free, available, convenient HIV treatment, we did not remove them. In our previous conversation, we had shown you that one of the key issues is support from our families, support from our colleagues. We are still stigmatizing and shaming people living with HIV. Or the people who themselves are living with HIV, because of what happened in the past, they feel stigma. We call it self-stigma. You are full of self-doubt and fear. and self-blame that you fear to come for HIV test because you expect people not to be supportive. But that also came from the fact that in the past, we have treated people living with HIV badly, which is regrettable. That really came from a lack of information. When we started the HIV response, there was lack of information. There was lack of stronger coordination. Many people came up with their own messages. Some of the messages were quite stigmatizing and painful to people living with HIV. So we see that people, in spite of good, we have effective treatment. You take one pill. When you started the HIV response, people would take a handful of medication. Now you take a pill a day. We have good treatment. Because the treatment is quite expensive, the government provides this treatment free of charge. And we have done our best to bring this treatment closer to the people, up to Health Center 3. But in spite of all the government effort to provide free medication, to provide the best quality of medication, and bring it closer to the people, many of our people still find a challenge in accessing an HIV test in time. We have HIV tests. Even we have self-test kits now. If you came home, if you came to hospital and you tested, we can give you test kits to take to your spouse back home who did not have transport to come. So we have tried to bring the services closer to people. But our people still face challenge, and we know one of the greatest challenge is shaming them, is stigma, is discrimination, which has resulted in continued death of our people. Ideally, there's no person who should be dying of AIDS now. AIDS shouldn't happen. But 20,000 died, especially men. They come late. And as I will show you later as we discuss, I will show you that HIV, the 1.5, more than 1.5 million people living with HIV, most of them are women. 930,000 of those are women. 930,000 out of 1.5 million. You can see they take a lion's share. But in spite of most of the people living with HIV, so if it is 930,000 are women, the rest are children and men. But still, when it comes to death, there are more men dying of AIDS than women. So there is still some motivation, some challenge we have to face with men, to find innovative ways as society to support men. Men are supposed to support others, but it seems they also need support now to make sure they overcome the challenges of stigma, they overcome the challenges of the poor health-seeking behavior. A man, you will see him losing weight, coughing, but he needs extra encouragement to go to hospital and seek medical care. A woman would have already planned to go. So we need, as society, to find a way of looking out for men and support them to make sure they don't continue to die from a disease we should have controlled by now. So those are the statistics, but when it comes in proportions, we see that now 4.9%, that's around 5 in every 100 adults, they have HIV. But it's different between men and women. So when it comes to women, for men, it is an average of like 3.5%, and for women, it's like 6.4%. So you can see it's almost double between men and women. So like I said earlier, it affects women disproportionately. And that has an explanation that I hope I will get a chance to give to the listeners.
Before we get to that explanation, of course you've cited out a number of things, and among which you talked about at least a 1,000 decrease in the infections. But what else have you achieved for a year among the targets you had for the year that you say as a commission, this is what we have achieved, especially in the fight against this HIV AIDS spread?
Of course, we had set several targets. But I will highlight prevention and treatment targets. In spite of our people complain that they are dying because they are not coming for treatment, but we see that a good number of our people are coming for treatment. Right now, we have estimated, or we know, that out of the 1.5 million people living with HIV, we have managed to put at least 94%. 94%, that's a good achievement. If you're doing mathematics, that's a distinction. 94% of those, we have tested them for HIV, and they know they're HIV positive. So the 1.5 million figure that we talk about, we arrive at it through research, through a methodology, we call it modeling. You take samples of people in Kabarole, in Karamoja, in Kotido, in West Nile, in Guru, wherever. And then now, based on that sample of people from all the regions in the country, you can estimate and say precisely we have like 1.57 million people living with HIV, based on the distribution of people living with HIV. Now, but the real people we have tested and confirmed, out of those we estimate to be living with HIV, it's only 94% of the 1.5. We would wish that all those who test and identified to be HIV positive are started on HIV treatment immediately, because that's our policy. We test you for HIV today, we give you your HIV treatment today without waiting. If you want a day to go and tell your wife, we can give you 1 day. But the more time you wait to start on treatment, the more the damage. So we see that there is a challenge there. 94% of all people living with HIV know they are HIV status, know they are HIV positive. But only 90% of those who know they are HIV positive are coming to get the free antiretroviral treatment. There is a challenge there, which together we must make a resolution to address in the remaining 5 years. The national commitment of ending AIDS as a public health threat, today, it marks that we have exactly 5 years to deliver that promise. So we must all work together. Everybody must do their part. I know there are so many people who like the last mile, who get energized at the last moment. Students who do their assignment on the last day. So all of those, we need their effort now, because we have exactly 5 years to deliver on a national commitment of ending AIDS as a public health threat. That means everybody's on treatment who has HIV. That means if they are on treatment, they don't transmit because they have supported them to take that treatment well. So of the 90% who are on treatment, the good news is that most of them are taking the treatment well to attain what we call viral suppression. People with viral suppression, they don't transmit HIV to their loved ones. People with viral suppressions live a normal healthy life. So 96% of all people on HIV treatment have attained the viral suppression, which means they're taking the medication as a doctor prescribes. So there is a message there for the people who are still affected by stigma. It looks like they are fearing what is not there. Because how come these 90% of people who are accessing treatment take it so well to attain viral suppression at the rate of 96%? So I believe that most of our brothers and sisters who are not coming for HIV testing, who are not coming for HIV treatment in spite of knowing they're HIV positive, some of the stigma is within themselves. I would want to encourage them that come out, because so many people who are in your situation have come out, they have benefited from this treatment, they have overcome the shame and intimidation, they are living a healthy, vibrant life. Don't be the one to be left behind, because the future is very bright. Research is coming up with really advances now. As we discuss, I will show you that now in prevention, we can give you an injection. One injection in 6 months, it removes the risk of contracting HIV completely. 2 injections in a year, you will not contract HIV at all. So advances in research, who knows that in a few years, you will be taking 1 pill a year for your treatment. So if you are already unfortunate to have contracted HIV, do not hide, do not be beaten. Calm down, access the medication that is available so that you don't miss out the advances in science that are going to come in the future. You never know, we may come up with a cure. You may miss out on the cure. Because if you don't come for treatment, AIDS or HIV actually leads to death. It will kill you. So I would want you to encourage your brother, to encourage your sister, because of the hope for the future, the hope which involves more convenient HIV treatment, even a possibility of cure. Let them come in a timely manner, start the HIV treatment which is there, so that they don't miss out on the brighter future. So, we at 94, 90, 96, as we said, in that cascade, and we hope that by 2030, we shall have really motivated everybody to play their part, and we shall not default on our national commitment of ending AIDS as a public health threat.
Before we talk about the symposium, two things that came up. One, when USAID closed, didn't Uganda AIDS Commission hit a snag in the fight to see that you achieve the 2030 goal?
Yes, without a question. USAID was our key partner. They implemented a couple of programs, including HIV prevention programs. So the most affected part of our program were HIV prevention programs. But we're implementing various innovations within the government system. We are engaging our partners to make sure we mitigate the possible hiccup or shortfall that was caused by the phasing out of USAID. But fortunately, the phasing out of USAID did not affect our treatment program. Our treatment program, if it's affected, then everything else gets disorganized. Because as I've told you, people who are on treatment, if they're taking well, they don't transmit HIV. So treatment in itself is a prevention program. It's a core prevention program. Our people on treatment, if they are not having the medication they need, they will start dying. We shall start going for burials. We shall start going, having wards full, because immunosuppressed people keep falling sick all the time. So fortunately, when the US government withdrew some of the funding, they were kind enough to maintain support for HIV treatment. And the support that was withdrawn, which was mainly for HIV prevention program, the government is doing whatever, moving pieces, reallocating resources to make sure we absorb that shock and we progress. So if there is going to be an effect, we may see it at the end of next year. The effect of the withdrawal. Because, when you withdraw services, the impact is not immediate. It's not immediate, but in the midterm, we shall see the impact of the US government withdrawal funding, the closure of USAID, and the disorganization it created. And we shall also assess the government's efforts to mitigate that, how effective they were. As it were, we expect to see some reversal a little. But if our efforts to mitigate that change in US government, the withdrawal funding, worked effectively, then we shall be happy that the reversal that we fear, if it is not seen at the end of the next year, we shall celebrate that we are quite responsive for our government and a responsive program.
There's also something you talked about that I do not want us to underlook. The infections among the females being overwhelmingly high compared to those of the men. What causes this?
There are two main explanations here. Number one, the available HIV prevention tools are in the control of a man. The tools that can easily be accessed and used depend on the cooperation of the man. So as it were, there is no tool under the control of a woman. The woman cannot implement their own prevention plan without depending on the man. That is challenge number one. That a woman, even if she wanted really to stay healthy and safe, she will still need the cooperation of a man. So it depends on the man. And that challenge, we are planning, or we have hope that we shall address now. We have invented new prevention tools. We have tools in forms and injectable. We have 2 injections now. One is already in the country, one is coming next year. I've told you we have an injection called long-acting cabotegravir injection. A person comes in, like the women come for the family planning injection. They don't warn you. If they don't want, they come, take the injection and go back home. So they will be taking that injection. It's discreet, it's convenient. We know so many women suffer from the over-controlling husbands. They need permission to swallow a pill for cough. You need permission from your husband to swallow whatever. So, and that limits their ability to access some of the prevention tools we have. So, but there is another injection. We call it lenacapavir. This is 6 monthly. We hope that will be helpful to women. A woman will have a prevention plan and implement it. If her spouse contracts HIV, it remains his alone. Because 2 injections in a year, most women can create that gap to come into the health facility, to come to the outreach program, get that injection twice a year, which removes your risk of contracting HIV. So we believe we shall empower women. But the second component is our culture. If you see the greatest number of new HIV infections, why there are disproportionately high number of women living with HIV than men, that problem occurs during the age of 15 to 29. There are disproportionately higher number of women contracting HIV during that time than men. And that damage cannot be balanced, cannot be evened out. I don't know whether I understand.
Yeah.
The women are contracting HIV at the highest numbers between the age of 15 and 29. And that is explicable. Our culture, the young woman is subordinate to a man, is powerless, income inequalities. They are looking for jobs. They are housemaids. They are being abused left and right. They are being exploited. They are generally looking for spouses, and they believe the stories the men tell them. So during that time, it's quite challenging. It makes the woman vulnerable. And the number of women that contract HIV during that age bracket, it cannot be evened out. As we grow older, above 35, we see that there are more men contracting HIV than women. But they are in smaller numbers. It cannot even out the problem between the age of 15 and 29 of young women, which is related to our culture and our socio-economic status.
Okay.
That puts a young woman in a disadvantaged position. So if we can find a tool that empowers a young woman between the age of 15 and 29 to have a prevention plan and be in charge of their prevention, then we shall have defeated the problem of HIV among women and the disproportionality, disproportionate effect of HIV on women. And we hope we have tools. In research now, we have a tool, a pill. We are doing research on a pill, which small pill you can take once a month. Once it is available, once a month a pill, even a young girl who is a housemaid, she can sneak out and buy pills, store of pills in a year, and she will not be in trouble. So we hope the future is going to be right. We hope if the communities are well mobilized, we all work together, everybody does what they are supposed to do, we shall deliver on our commitment. We shall not default on our commitment to end the AIDS epidemic by 2030.
Well, Doctor, we know that Uganda AIDS Commission has organized the National HIV and AIDS Symposium. Tell us about this symposium. Why is it going to be, and why does it come? When is it going to be? Who should be part of this symposium?
Thank you. So the HIV Symposium, it has several things in one. Number one, it's part of our own society mobilization as we gear up towards World AIDS Day. So World AIDS Day, which comes on 1st December, every year we have a symposium, a scientific meeting, meeting with the community. This is a meeting of scientists and the communities, because we realize we have so many tools. I have talked about the pill, have talked about the injectables. So many of our people do not know that these tools are there. I recently was traveling around the country and I stopped to ask the people that, are you aware this country has a campaign, a commitment to end AIDS as a public health threat by 2030? So many people do not know that the country believes we have what it takes to end the AIDS epidemic. We have the tools. Number one, they don't know all the tools. Number two, they don't even know that we have a campaign to end the AIDS epidemic. So we have decided for this year, we shall be moving out to the community. We take the scientists, we go with the scientists, we go with the service providers, we go to the community. The communities come to us, like we have gone to them. They ask us questions. They see the tools we have to contribute to the ending of AIDS. Everybody gets to know what works for them. It's a matter of choice. You come, you find the science, ask us questions, we show you what we have, you choose what works for you, you get empowered. So for this year, our science community interaction, we have taken it to Mbarara. Mbarara, because we have targeted that region of Western Uganda, Southwestern Uganda, for mobilization to champion our campaign for the next 5 years to end the AIDS epidemic. Next year, we shall take this campaign to another region, but this time we have targeted Southwestern Uganda.
What do you base on to choose a host for the symposium?
There are several factors. Of course, how recently did you host a similar event? That's the factor. Where do we see the greatest number of new HIV infections? Where do we see the risk factors growing? Like Mbarara is a city, there is a growing number of sex workers. The neighboring districts of Bushenyi, they have plantation workers, growing number of border. We'll be monitoring where the risk factors are growing. So we can see another region like Hoima now. The manufacturing, the mining of oil, we expect the mushrooming. So when you see us going to Hoima, know that we are targeting all those. We are monitoring the country. We see where is the risk highest, where is it growing, where is the region least mobilized, where should we take our drums now. So we decided to take our drums to Southwestern Uganda. It has, I think, the second, if not the third highest prevalence in all the regions, so it's one of the highest, but we see growing risk factors for an expanding epidemic. So we want to mobilize that region, and that's why the World AIDS Day is in that region, and the symposium is in that region. The symposium is also an opportunity for researchers. We have so many scientists conducting HIV/AIDS research, for them to disseminate, not to themselves, but to the users, to the public, to the health workers in the communities, the research findings that we know will contribute directly to attaining our goal of ending AIDS as a public health threat. But the symposium also is a review, is a sector review. Like you asked me at the beginning, we set targets for this year. We set targets and we are counting on various stakeholders to do certain things. It's a multi-sector response. We are counting on the faith sector, the churches and the bishops and the reverends to do something. We are counting on the schools to do something. We are counting on the hospitals to do something. We are counting on all sectors. So this time for all sectors to sit down and we review. And we say, but you see, we set out to do the following. The churches, you let us down. The schools, you let us down. What can we do differently in the next year to make sure we work together and deliver the national commitment? So it's a reflection, review, appraising our performance, and really re-energizing ourselves to attack the next year with a renewed purpose. So it's a mixture of things, but most important is that we want to do with community. Because eventually implementation, the real work that will lead to the ending of the AIDS epidemic is done by individuals, it is supported by families, it is from communities. So we must take this message to communities, and as it were, the symposium is open to the public. We shall be at Mbarara University, next to Mbarara Hospital, just by the roadside. There is a park there, outside the hospital. So that's why we shall be on a tent. We are open to the public. We want everybody who has a relative in Mbarara, anybody you think should come and be changed and learn something about HIV, to come to our function, to interact with the health workers, to interact with service providers, interact with the scientists, so that we can advise them on what choice, what is available that will fit their needs for HIV prevention and care. And we look forward to seeing all of you there. Simply walking, and we are specifically targeting young people. We're interested in young people, so we have vacists. Anybody with vacists back in Mbarara, back in Bushenyi, give them transport and ask them to come. We see that the greatest number of new HIV infections are occurring among youth. So we would want to see as many youth So if you have a young brother in Imbara, send them transport. Support them to make sure, encourage them to come to the symposium. Maybe they may be inspired and run a new skill, get inspired to become a doctor like me. Or they may discover that there are tools of HIV prevention that fit their need. If they are not inspired by the scientist who is teaching them, they will be inspired by the product they are showing them. So in either way, they don't lose. So encourage the youth in the Mbara region, in the Ankole region, support them to come to be part of that symposium. We see that HIV epidemic affects the youth disproportionately. Let them come, let them benefit from the opportunity.
So I see the symposium is for 3 days,
Yes,
from the
it
26th, 27th and 28th.
Yes, it is.
Are there any arrangements? So for example, I look at someone who comes from maybe a distant space and they want to attend all the 3 days. So do you have any extra arrangement like accommodation for those, or is there a pre-registration that is required for all who will attend? All you come and go without any registration prior to the event?
That registration is not so necessary, but we shall be sharing some online registration for those who want to participate virtually, those who cannot make it physically. But I find the virtual option very complicated, especially for a young youth, a busy person in the. So I would encourage that we all participate physically, and you register on arrival. You register on arrival. There will be options we shall be sharing on social media on registering for virtual participation. I cannot cite the Zoom link in my head, but we shall provide Zoom links for those who can participate virtually. But I would encourage everybody to come in physically, and when you come, really, you must pack lunch. You must pack your own lunch. You must call a brother who stays in Imbara and you stay with him to save some money on accommodation. We don't provide accommodation. We don't provide meals. For us, we are only providing you inspiration and science and information and showing you. And we know there are so many young people who are self-organizing in the communities. If they came and learned this new information, they will be quite impactful in their own communities. Young people find a way of organizing themselves. We believe if they come and learn something new, they will help us disseminate these messages down in the communities and contribute meaningfully to our fight to end AIDS as a public health threat. So we would want to encourage you, don't miss this chance to come and interact with our scientists and learn and be of a contribution to the national campaign of ending AIDS as a public health threat.
Building sustainable HIV response to end HIV as a public health threat is the theme. Why this theme?
This theme is so timely. You have discussed that you said crossed and we were left in shock, we were left fumbling around. We don't want that to happen again. And what were we disturbed? Our response, our HIV response depends heavily on the donor. For quite a long time, I would say that up to 80% of the money we use for the HIV response comes from external donor. You saw what happened when President Trump took over as the United States president. He switched, changed policy, almost withdrew all the funding. Thankfully, I think there are other forces that pleaded with him, and he slowed down. But you can imagine if he had withdrawn all the funding, including HIV treatment. President Trump, or the US government, is also the major donor to the Global Fund. The Global Fund is another source of funding for HIV response. So if he had withdrawn all that money, he withdrew some of the money. We had to sit back and replan the little money that remained. So from that painful lesson, we reflected as a country and we said, we must implement our HIV response in a way that is sustainable, that has no external threats. Even if Trump was not there, even if donor money was not there, the response shall continue. The people who need the medication shall get it. So that is what we are talking about. And it involves so many sacrifices to implement a sustainable response. It means we must live within our means. with donor money were used so many good things. They were supporting our program in innovative ways, quite expensive ways that we would not naturally afford. But we must live with efficiency. So one of the discussions of sustainability is that how do we live in efficiency? For example, you will hear now that we have changed our HIV treatment model to what we call an integration model. Long ago, we would have a separate HIV clinic, separate HIV doctor, separate HIV lab, separate HIV pharmacy. But we have now combined all of them. So that one pharmacist serves the people with malaria, serves the people with HIV. Because we don't have the extra stuff. That is called integration, that is improving efficiency, and that is the conversation we must take to the community. Long ago, and that was with justification. Because when we started the HIV response, there was so much stigma. A person living with AIDS, coming to line up in the hospital, he's pale, he's cachectic, he's wasted, he's thin, he's unkempt. Everybody would see that you are, because of pain, you don't have time to beautify yourself, to comb. And people would stigmatize them in the clinic. So it was a safe space to start a separate HIV clinic for the dignity of our brothers who already had HIV. But we believe that era has passed away. A person living with HIV now, because we start them out on treatment, can sit with a person with malaria, and none of them will know who has HIV. So we are moving in that direction, but the reason we are moving there, it is painful for some people, because the HIV clinics are themselves very heavy. The sickle cell clinic is heavy. Now you're combining both of them. The lines will be so long, but we are asking the people, bear with us. That is what we can afford. And we shall live within a means, but the most important thing is that whether the US government changes, whether the donors are at war, our people shall live with dignity. There will be no scrambling for drugs, because we shall be having the drugs from our own sources without depending on an unstable source. So that's what sustainability is about. We are self-sustaining. We are no longer depending on. We are moving towards self-sustaining, doing things our way within our means without being affected by external forces.
We know by this day next week, you'll still be in Mbarara celebrating, commemorating World AIDS Day. Kindly, briefly tell us about the World AIDS Day celebrations that will happen next week.
So the World AIDS Day, we are going to commemorate it in Bushenyi district. In Kizinda. So you can see as you drive out of Bushenyi towards Chamhunga, there are plantations there, plantation workers. They are quite rich people. So those are two factors. Plantation workers, they get money, and where such workers are, sex workers don't move away from them because they live where they are. There's money. Recently I had coffee farmers who are also struggling deep in the village. The sex workers have pitched camp where there are coffee plantations. So for plantation workers who work in tea factories, in forests, there are pineapple plantations. So they have a little bit of money, and that puts so many young men at risk. So we want to take our campaign there. We will be hosting the head of state as our chief guest, as a guest of honor, who is the chief champion of the HIV party in this country. Like he always says, that AIDS, he learned early on from once in 1986. Once he had a conversation with the doctors and they told him how HIV spread. It's not spread through mosquito bites. It's not spread through handshakes. It's not spread through sharing food or sharing vegetables. So for him, his conclusion is that AIDS is a simple disease. But that simple disease, in the minds of so many people, it's not a simple disease. But we are hopeful that he's taking his message deeper, closer to the people like he did long ago. But you see now, it's a whole different generation. He has made these rounds across the country in the past to educate the people. But now there is a whole new generation of young men like yourselves now who never saw him doing these messages and campaigns. So we are privileged that he still can do this and is willing to do this. So we'll be bringing him to, he'll be coming, to Ishaka Chizinda to address the masses, to motivate you, to mobilize you, to show you that we can actually deliver the national commitment of ending AIDS as a public health threat by 2030. Like I said earlier, it means we have reduced the number of HIV new infections to almost nothing, because we can do it. If our brothers who already have HIV, our sisters already have HIV, we support them and we don't shame them. They take their medication as the doctor prescribes. They will no longer transmit HIV. They will not die. They will stay there. We shall enjoy them as our brothers, but they will not transmit HIV. I have told you we have so many tools, including tools now, which can be in the control of a woman. In the past, we did not have tools in the control of a woman. These tools are available. You only need to come to us and we show you where they are. So as part of the commemoration, there are so many activities going on across country, mobilizing towards the World AIDS Day. But even on that World AIDS Day, we shall have several service providers with the various tools. So we encourage the Bushenyi community, let them come. If you have a relative in Bushenyi, let them know that the president is going to be hosted in their district. The chief champion in the HIV fast, he will motivate you to believe. Like I said, he believes AIDS is a simple disease. It should, according to him, should have ended long ago if everybody cooperated. Okay. But we shall find a way of bringing to them messages of hope and teaching each one of them what they need to do to make a contribution that will make this simple disease go away, which has caused so much damage to our country, because putting one person on HIV treatment costs so much money. We would not want to see anybody add themselves the number of people already living with HIV, the number of people the government has to look for resources to put on treatment, because the amount of money we spend on one person for HIV treatment per year is close to 1 million shillings. There are very few families that can afford 1 million for treatment per person. There are very few. So most of them must depend on government. Yeah. But if you look at the consequence, so if you get 1 million and you multiply by 1.5 million people living with HIV, that is too much money. If the number of people living with HIV keeps growing, then it will be a crisis. So we would want everybody there. And you know, the problem is, the more we have put people on treatment, people have become complacent. People have lost the respect and fear of HIV. And all of them believe if I contract HIV, I'll go on treatment. But who would want to encourage you that treatment is not food? That is number one. You need to hear the story of people living with HIV. I have been at talk shows like this with people living with HIV, and most of them are honest. The struggle they go through taking that medication. So if you're there thinking, I contract HIV, I be on treatment, it is not like treatment for cough, which you take for 3 days. Even treatment for cough, many people struggle to adhere to cough treatment. So we would want to encourage people to embrace prevention, learn the part you can play. I promise you, we have the tool that may work for you and fit in your prevention plan, so that you avoid contracting HIV and adding yourself on the number of people already living with HIV who need treatment. If the number keeps growing, the time will come when the government really cannot, because you cannot draw money from schools to buy medication. Yes. It will be so difficult. Yeah. We don't want to get to that time of scramble. So we encourage people, we have what it takes to end new HIV infections. Find out what you can do, and together we make history.
Thank you so much, Dr. Daniel. And of course, like he has said, please be part of the symposium, 26th to 28th of November. That is from Wednesday to Friday this week. And also endeavor to attend the national commemorations in Bushenyi. That is on the 1st of December. Well, we've come to the end of issues at hand. Edrine Austin Mukala is my name. I've worked with Patience, Mumza, and the entire team. And from the entire team, we wish you a blessed day.